All right, this is Dr. Andrea, and today I'm going to be talking about spinal degeneration. And there's 3 phases of spinal degeneration. First, we're going to talk about normal. This is a normal vertebral segment in the body. So notice how the 2 vertebrae are nice and thick, rounded edges with a good thick intervertebral disc separating the 2 vertebrae. Keep in mind, the thicker the disc, the more space between the vertebra. The more space between the vertebra, the more space that the nerve that comes out between the 2 vertebrae has. So, normal vertebral spinal segment, good spacing, no pinching on this nerve. Now, based on wear and tear, microstressors, see a previous video for that, or even trauma, these vertebral segments and disc will start to wear down. So as this happens, notice these vertebrae are not as thick as they were in the normal, and the disc has started to dehydrate and thin. This is a intervertebral disc herniation, but ignore that for now. That's a topic for another video. And so notice that as this disc is becoming compromised, the spacing that the nerve comes out of has shrunk down. So you may or may not have symptoms at this point in spinal degeneration. Symptoms you may have would be numbness, tingling, shooting pain down into your arm or your leg. But there's still a decent amount of space, so you may or may not be symptomatic. All right, so if that goes untreated, that could lead to phase 2. Notice in phase 2, more shrinking of the bone, and notice how those sharp edges are becoming pointier and leading to what we call spurring. Spurring is a sign of arthritic change or arthritis in the spine. So the more this happens, the more the disc desiccates or shrinks down. So the smaller the disc, the more these bones rub. The more the bones rub, the smaller the hole is for the nerve to come out of, more likely to get pinching on that nerve, more likely to have symptoms. All right, and if that still goes untreated, that could lead to phase 3. Now, this phase, you are most likely symptomatic. Notice spurring, or that arthritic change is even worse. The disc, well, in this model, it's pretty much gone. You can see it way back there. But the disc is very small, very dehydrated, not separating those vertebral segments at all, most likely pinching on that nerve and leading to those symptoms I mentioned before. Now, you might be wondering what you can do to stay looking like this and to avoid these phases of spinal degeneration. Good news is regular chiropractic care can help prevent and in some cases even reverse spinal degeneration. Other things you can do at home is adequate hydration, movement, and nutrition. However, keep in mind, you may not be symptomatic if you look like this or even like this, which is why it's important to get your spine checked.